like you said, fundamentals is the basis of your test. So it has a bunch of things it covers. So let's try to master this aspect of your test. Okay, so let's go. What do you have? Which of the following teaching is appropriate? Be sharp in your answer choice. Be sharp in your answer choice. And next is caring for a client with what? Worsening what? Macular degeneration. Which of the following teaching is what? A priority. Bring your content and think about the key aspect. What is the problem with macular degeneration? Well, your central view is going. You can't see anything in your central view, right? Central view is affected, peripheral is intact. They're going to lose their vision, and their priority is what? Safety. Safety, safety, safety. Therefore, which of this indicates safety? You see the way I'm approaching my answer choice? Safety. Ensure large print on your labels. Mini safety. Wearing your glasses. Safety. Public transportation. Safety. Lock your door. Safety. But which one is the most important safety precaution you should take with this patient? Well, they can have a large print of their prescription or other stuff, whatever. They can wear glasses, but the most important is no, I don't want you to drive. You're losing your vision. You're going to get an accident and you die. So use of public transportation is the number one. You can wear glasses, but you can still not see perfectly. So I want you to take public transportation because you're losing your vision, you get into accident. That's not good. That's the number one safety precaution. Number two, what do we have? And this is expecting a severely injured client to the ward. Which client should the nurse discharge to make bed available? So who do you discharge? Not who you should see. Who you discharge is stable patient whose needs has been met. Okay, you are thyroidectomy, your deep tendon reflex is class 3. That means you are hyperreflexia. What happened? Low calcium causes hyperreflexia. When you have thyroidectomy, you are at risk of hypocalcemia. Hypocalcemia can cause what? Hyperreflexia. Therefore, that's why the reflexes are. This patient cannot go home. Diverticulitis, why cannot 12? That's what I expect. But the client is not eating yet. That means they should go home when they're eating at least full liquid diet. Their pain is well controlled and their white count is down. You are not ready to go home. Myocardial infarct, troponin is trending down. It's trending down, does not mean it's normal. I want it to be normal. COPD and your PO2 is 81. This is 80 to 100. You're good. You can go home. Number 4 goes home. Number 3. And then a charge nurse is giving a break to the primary nurse. The client with MRSA need wound care. Which precaution the nurse should take? This is a really good question. You got to think about it. What precaution do you need for MRSA? It's a contact. When it's contact, you wear what? Gloves, right? And gown. When you have to touch a wound, you got to protect your face, splashing. So you got to add goggles and a face shield. You don't need a sterile gloves. This is not enough. You wear gown, goggles, face shield, and non-sterile gloves. This is enough. You wear gown, goggles, sterile gloves. Your face is at risk for the infection. So 3 is a better choice. That's the way you do infectious control. If you master this, there's no question that was, and you get it wrong. And adapt NCLEX videos, look at it. I have a bunch of infectious control, how to answer them. NCLEX practice question playlist. Watch them. You will be golden. Number 4. And nurse observed a co-worker violating the pharmacy policy on how to waste the medication. Which action is the most important for the nurse to take? Your co-worker is violating the hospital policy of how to waste medication. What should you do? What should you do? This is always going to happen. It's going to, even if you get in your test or you go to the ward, there's a protocol you're supposed to follow. Incident report. This is a safety issue, okay? It's not going to help anybody. Discuss the situation with another nurse. She's not going to help you. It will be gossiping everybody. Inform the charge nurse. She can take in charge. He or she will make sure this is rectified. Confront the nurse. You guys are going to fight. He will tell you, who are you? So 3 is the best one. Whenever you have such situation, charge nurse, that's the word charge. Charge is in charge. Report it. You are not snitching. Number 5. A nurse is caring for a client who need MRI. Which action the nurse should take first? Somebody need MRI. What should I do first? Priority. These questions are very tricky. You got to think about it carefully. You have a patient, need an MRI. What should you do first? You call radiology department to schedule the MRI, complete MRI questionnaire per protocol, check if the client agrees with the exams, or verify. You see, I'm underlying keywords, the physician order. All of them are right. But the first thing when you get an order, go get an MRI, check with the physician that you verify the physician order. After you verify, you tell the patient, hey, you're going to get an MRI. Do you agree? Do you want it done? They can refuse. After they do that, you do the questionnaire to make sure all the checklists per protocol before you call the radiology and schedule it. Okay, after you schedule it, you remove the patient if they have metallic object or anything, and then when he's ready, you take the patient out. So this is the number 1. Verify the order and make sure that is a true order to get an MRI done. Number 6. What is the next best action? Best priority. A nurse attempt to infuse potassium chloride IV to a client with hypokalemia. The pump indicate maintenance is required. We got to maintain you. This is the pump, okay? And the machine said maintenance is required. What would you do? You have to be smart. You're going to give a deadly medication to a patient that need to be delivered through a pump. You should not do IV push. And the machine said, I'm not working properly. Well, you should not use me if I'm not working properly. Give the potassium using a pressure bag. You cannot give this under pressure. You kill the patient. Like this is euthanization, basically, just like death chamber. You just slam in it. No. This is the same thing as IV push, giving the potassium IV push. Wrong answer. So this is how you identify questions. You can figure out something is wrong with the questions and the answers. The 1 and 2 are doing the same thing. Don't let them trap you, so you cancel them. Tag the pump for repair and get another one. Excellent. Ignore the statement and use the pump. The pump told you, I'm not working. Why do you ignore me? Patient is going to get into trouble. Safety. Number 3 is your right answer. These are all safety questions. Number 7. A nurse caring for a client, on the last floor of the hospital building was notified about there's a severe thunderstorm protocol being activated. Which action by the nurse is appropriate? Let me rephrase it again. Always rephrase the question the way you understand. There's a thunderstorm coming, hospital policy is being activated. What should you do as a nurse? You know, thunderstorm is like breakthrough things. The best way is to stay away from windows. Windows are going to break. So move bed close to the window. No, away from the window as much as possible. Keep bed at the client's desired height. No, this is no luxury now. We have to go low. low. The bed has to be on the lowest as much as possible so that when glasses are flying over there, it does not affect you. Close all main door. This is strap. Main door, no. All doors, whether you are main or just a regular door, should be closed, not just main door. Relocate ambulatory client to the hallway. People who walk should go to the hallway to be far away from the room. They are in the hallway, so they don't being protected by the actual room that they are in. So this is the best action. So that's the way you answer this question. Number 8 is of safety. A nurse need hospital bed for a client with what? MRSA. Which client should be recommended for discharge? The same thing. Patient, we need a bed for patient who is ready to go home. Abdominal bruit and the back pain, he has AAA. He's dying. He's not ready. This patient is a big sharp patient. He needs to go to the OR right now. Hip fracture after fall and knee surgery next day. He's unstable. He can't walk. He has a fracture. His leg needs to be stabilized. He can have fat embolism. He's not ready. Rotate the calf, pre-admitted for surgery next day. This is an elective. It's not going to kill him. CHF and a pink sputum, it means the patient is in pulmonary edema. Who do you think is really sick? I have AA, abdominal aortic aneurysm, who is going to die. Somebody who has a long bone fracture that can have fat embolism. Somebody who just have a rotator cuff, and somebody who is in pulmonary edema. Rotator cuff, we can reschedule your case later on. Number 9. I know I make it easy, but it just contents putting together. A fire broke up on the 6th floor of the hospital building. Which action should the nurse take first? It's all concept. Fire. You see, underlying keyword. Fire, action, first. Okay? And you know, when you see it, every time you see fire question, right? Raise. Right? Rescue the people near. Activate the alarm. Close all doors. And evacuate as much as possible, or extinguished, right? This is extinguished. So activate the fire alarm is not number 1. Closed all the doors, fine. Somebody is dying near the fire. Obtain fire extinguisher, okay. Rescue any client in close proximity of the fire, yeah. This guy needs to be rescued first, then you activate the alarm, close our door, and then do whatever you got to evacuate, extinguish everything that they need to do. Okay? Number 4 is your first thing you should do. And number 10, a client has a high risk of fall based on a nurse initial admission. Which action should the nurse take first? You see, I've underlined the keywords. These are high risk of fall. What action should you take? Buzzwords as being aligned. If I am high risk of fall, then I should have a safety staff being instituted. Place client room near the next station so that we can see you when you get up. Use chair or bed sensors. So whenever you get up, you make an alarm and I know you up. Dim light in the room. Wrong, you're going to fall. Provide non-skid footwear. Yes, safety, you don't slide. Keep 1 bed rails up for unconscious patient. He's unconscious. He will not going to pay anything. Why do you want to pay 1 bed? Both of them up. He's unconscious. You don't know when he's getting up, and then he will fall. So both bed need to be what? And raised up. So 1 bed up is not a good thing. That guy, you don't know what is going to happen to him. So, hey, keep both raised bed up. Both of them. So 1, 2, 4 are your right answers.